So I'm Peter Temple and I'm the Trust's Lived Experience Lead, and I run the Complex Emotional Difficulties Team Peer Support Service across Cornwall. So we're here at the Healing by Nature site. This t-shirt was designed and printed by one of our peer support members, and that's a really great start into what we do. So we find things that people are skilled at and passionate about, and we really try and capitalise on all of that. So one of the things that when we first started our service we did was do a service evaluation. So we asked everybody that came along to our peer support groups around Cornwall in Liskeard, Penzance and Redruth to name 3 things that help and 3 things that hurt in the helping relationship. Because what we were hearing, people with complex emotional difficulties, so people who manage life through self-harm, unhelpful drinking and drug taking, restricting or overeating, managing trauma through putting something else into that space. What we were putting into the space was unhelpful. Then we were coming to services to ask for help for that. And unfortunately, the message for our particular patient group is either that we're too unwell, so too high risk and engaged in too high risk behaviours to receive a helping programme, or we're not unwell enough. And so there was a gap population that we talked about in services that fell sort of too complicated for your talking therapies, your DP services in primary care, and not severe enough to warrant treatment in secondary care. So where we come in as a peer support group is to say, you don't need a diagnosis, you don't need to be under secondary care, you don't need a referral. We exist in these spaces and we would love to come for you to come along and join us. And the reason that we do it outside is because we want it to not look like a medicalized solution. We want it to look like connection, social empowerment. Where we had 30 different groups and members of the VCSE come along and add to everything the service users had said. So we spoke to the end users, then we spoke to the people who are delivering services in the community and in the NHS. And from that, we've developed this plan, which is the Healing by Nature site. We've raised just shy of £200,000 so far. We're in the final round of another £55,000 grant now. And what we're going to use that money for is, here we're in the walled garden, we're putting on events like today, we've got apple pressing going on behind us, which is lovely. When it's fully built, and we are a group who plans to build it ourselves, once it's fully built, it will include this walled garden area, hot tubs as you go down there, wood burning hot tubs and cold water plunge pools. We're in conversation with Mott Sauna to get a sauna there. All of these things are really evidence-based treatments, so I won't go into all of the evidence and research, but it really is very much grounded in the science in terms of how these things can help us. We've got a yurt at this side of the site which will be powered, so if you want to come and run a training and you need a PowerPoint, you can go into yurt 1. Down there, the next part of the site is the hot and cold water relaxation area. You come through to a Neolithic roundhouse, which will eventually act as a camp cafe and kitchen, run by us, staffed by us, working alongside the IPS service to help people move back into work or training if that's what they'd like to do.
I think we're here to see people, to meet real people, find out of all the great things that are happening across Cornwall, supporting people with their mental health by connecting them with nature. That's for me.
Yeah, I think it's similar, just making those connections, sharing the message about nature connection, getting people out into nature for the health and wellbeing benefits. But it's everybody's very much on the same sheet here, which is great. But anything we can do to support that nature connection and the health and wellbeing benefits of getting out into nature for everybody.
That's really useful for days like today is that we can learn about projects that are working really well in the community, and then we're able to advocate for them in other regions. So yeah, if there's something that's working well in Cornwall, then we can suggest that it might be able to be replicated somewhere else. Yeah, it's incredibly inspirational, and I think it comes down to people really caring and believing in this work that really drives it forward, and then that in itself really benefits the people who are benefiting from these services.
I think it's that passion as well, isn't it, Kate? There's just so much passion for the subject, and and the support with getting people out into nature. And I think, again, the more people experience it, then we feel the benefit of the nature connection. Then it grows. So it's just great to come and share a day like this, and it's such a good place to learn, because you're just in that natural green space, and it just promotes sort of that well-being, those discussions, and taking things forward.
It's great to hear that there's plans to do more things like this. I think a holistic approach to healthcare is really important. It's not ever a one-size-fits-all. Nature will work really well for some and maybe not be the cup of tea for others, but ensuring that it is an option and a tool in the toolbox that we can use to support people, to find the things that work for them, to be able to support themselves with their own mental health and well-being is really, really important.
I think staff and patients as well, isn't it? It's everybody that benefits from it. Just it's just going out for a 5-minute break at lunchtime, going into a green space, and just really appreciating. Because sometimes just stopping in a green space, just see what you can see, what you can smell, what you can hear, and just what you can feel. It just really does make you, really does help. And again, the more people are connected with nature, the more likely we are to look after an environment, which is so important. Absolutely, I think the networking is just so powerful, and just so Kate was saying earlier, just sharing what we're all doing and learning from each other, learning what does work and sometimes what doesn't work, but just getting that body of support for nature connection, and the health and wellbeing benefits. It's just so powerful, and we need to do it as a group so that we can take it forward and share it.
And it's a way to connect with nature ourselves and to connect with people, and that's really important.